Kahnawà, and welcome to another public safety, public health update. We felt it important today to have a show just to bring everybody up to speed on some of the latest developments in and around the community, address some of the multiple questions we've been receiving, as well as provide you some, some of the direction we will be doing moving forward. We have a lot of information to cover this morning. Lisa will be here in just a little while to give you some more details on some public health measures, but I want to first start off by talking about the extension of the state of recovery, which was passed by consensus by Chief and Council yesterday. There was a press release that went out that clearly indicated that was the case, which we felt was important that we make that recommendation to Chief and Council. Given the current state that we're in, we are certainly not at an area that we feel confident that we are achieving that normalcy at this point in time. There still is a level of alert that we need to maintain in the community, and we still have to address public health measures as deemed required. And we also want to continue working with the authority granted under the Kahnawà Emergency Preparedness Law, and that is done via a Hall Council Executive Directive and under the Emergency Preparedness Law. So that was extended for additional 30 days. That actually extension kicks in next week, and it runs until January 18th of 2022. And at that point in time, we will continue to assess where we're at and what the next steps may be. I know there's a lot of information in the news over the new variant that's happening and developing around the world and across Ontario. We've seen that a significant amount of new cases are the Omicron variant, and we felt it's important again to put some things into perspective and also I'll give you some information on that. But despite the what's happening around us, we're trying to guide the community in a way in which we feel that is extremely important to continue on that path towards recovery. There may be some temporary setbacks, and we have to reassess as we're moving forward. But definitely, we want to continue down that path to a recovery phase where we feel confident that we could formally end the mandate of public health and public safety in respect directly to the recovery phase of the pandemic. So that still remains our goal. I just want to talk a little bit about some of the differences between the beginning of this year and the end of this year. In January of this year, January 2020, as you recall, just right after the holiday season, we entered our second lockdown, or second closures, when all non-essential businesses were closed down. There was a lot of restrictions on gatherings, minimize people within homes and such, and that happened, and that was for a period of 1 month, with the goal of breaking the trend of increased cases and increased deaths that was happening. A lot of cases in the community and a lot of deaths across the province, and this was done, and it did have its effect. In February and March, the numbers continued on a downward swing, so it did have its effective outcome. So in January of 2021, the average cases were about 1,600 per day. 7-day average was approximately 1,600 per day in January of 2021. What we are seeing now is 1,600 cases on a rolling average. So over a 7-day period, the average is 1,600 now, as the same as it was in January of earlier this year. The big difference is twofold. Fortunately, due to the rate of vaccination within our community and across the province, the big difference is the death rate has drastically reduced. For example, in January, the 7-day average was 50 per per day on average of deaths. Now in across the province, it's about 3. So that's proof that the vaccination is working, that it's having its desired effect, and that as long as people continue to get vaccinated, and as long as people continue to be safe, we could remain in a stable place, moving forward. Even though there are some concerns, which Lisa will talk about in just a little bit. But I think it's important to put that a little bit into perspective, because I know there's a lot of news out there, and there's a lot of unknowns, and there still is some unknowns. But we want to try to maybe alleviate some of the fear that some people have expressed, that we are in a much different place than we were almost a year ago, despite the numbers being the number of new cases being roughly the same. And speaking about vaccinations, we did put out a number of releases recently, and matter of fact, today, starting again at noon till 8 o'clock this evening, there will be a vaccination clinic over at the Knights of Columbus Hall. Starting from 12 to 5 is for booster shots for adults 18 and plus, and they are. We do have both Pfizer and Moderna available, because I know that is a question that many people are asking. But if you are under the age of 29, you will be given Pfizer as a booster shot to lessen the possible side effects of some issues regarding myocarditis, which is inflammation of the heart. So that's again. A process that we have. Again, it's going to be Wednesday as well, Friday, Saturday, Tuesday, and Wednesday. These schedules will be reposted once again, so we are encouraging people, obviously, to get your booster shot, because if you watch the news and you watch everything that's happening around the world, almost every statement made by an epidemiologist or by a doctor or another health professional ends with the fact of saying vaccination is still the key for us seeing our way through the pandemic, is still the best way to keep you and your family safe. Also, in Kahnawà and other First Nations, we're fortunate that we have been able to start, as of the past week or so, booster doses for 18 plus, whereas other places are still looking to after the holidays before they lower the age category for booster doses. So because of the vulnerabilities of our community and many of the things we talked about over the past couple of years, we are more vulnerable. Therefore, we do have the vaccination and booster doses available for anybody 18 plus within our community. And also for those who are working in key areas in Kahnawà, close with our people, are also eligible for their booster dose as well. We ask people to be patient. We're working out of the Knights of Columbus Hall. Previously, as you know, we were out of the Super Bingo, much larger facility. So we do want people to be patient. Walk-ins are welcome, but we still ask people to book on through Kahnawà 911 site on the Click Santé to book an appointment. We know there was issues with the site. That's unfortunately beyond our control. But it is up and running again. So we ask people to book an appointment. That way you secure a spot for yourself to be vaccinated at a time that you want. But if worse comes to worse, walk-ins will be taken. As well, for the children, there are for the evening for ages 5 to 11. Again, this evening, Tuesday, from 6 to 8, Wednesday 6 to 8, Friday 6 to 8, and as well Saturday, which will be the last first dose clinic for children 5 to 11, will be held again Knights of Columbus Hall from 1 p.m. till 4:30. After that, anybody who wants to have a child from 5 to 11 vaccinated will have to go through the regular Quebec Click Santé and book an appointment outside of Kahnawà. But we feel that these dates and these times will give anybody who wants a vaccination the opportunity to get it done within the community. So on the 18th at 4:30 will be the last time for that age group. After the holidays, for second doses, we will be releasing a schedule once it's time for a second dose for the children. We will be putting that schedule out after the holidays, so you could have your child get the second dose. Also, I also want to talk a little bit about restrictions and measures, because I am sure, like most of most of you are like me. We watch the news often, and there's a lot of talk in various jurisdictions in the provinces across Canada and around the world about tightening down on restrictions, and parts of Ontario are even doing some serious limitations, and there's talk of lockdowns in areas such as different parts of the world. I want to reassure the community, that that's not the place that we are at this point in the community. We are at a heightened level of alert. We are still in a red zone where we have to be extra vigilant and extra careful. But because of some of the stats I talked about a little bit earlier, and where the death rate is low across the province, and that the vaccination rates are doing well, we are in a different spot. I can't say 100% certainty that no restrictions won't be imposed in the coming weeks, if definitely need be, but that's not the path that we want to follow. We want to stay the course. We want to remind the people to be extra vigilant, be extra careful, and take this seriously. And we could weather the storm. We all want to have a holiday season. The holiday season, for the most part, has already started. People are getting together with friends and family, do so in a safe way, and obviously moving forward in the coming weeks, keep that front and center in your mind to keep your family safe, especially obviously those who are not eligible to be vaccinated and those who are of the more vulnerable population. Again, it's everybody's collective responsibility to keep everybody safe. One note that Quebec has increased its I guess gathering level in a private residence to 20 people. We have, in our phase 5, we had left it at 12 people. That again is something that we are certainly recommending to everybody, to keep your gatherings down to a core group as much as you can. We understand it's difficult, but if you limit the amount of exposures of people, you minimize any possible outbreaks. So again, nobody's going to be knocking on your door to count heads, but again, that's something that we put in the hands and responsibility of the community to take that information and make your decisions accordingly in the best interest of your family and friends. So we have more information coming up. Lisa will be here to talk some about the issues and some of the public health measures and some new and I guess somewhat exciting information as well. Thank you very much.
Good morning. So quick update on our number of cases. We're currently at 23 active cases in the community. There are 14 new cases since Friday. So we had 11 or 12 on Friday and 2 since yesterday, and a few people who are also recovered. And important to note that a huge proportion of our new cases still are within the 0 to 10-year-old age category, and we have very few new cases in the 70+ category. So this is good news, because we are seeing protection of our elders, which has always been a more vulnerable age group. So Lloyd touched a little bit upon Omicron, and I just wanted to touch a little bit on that as well, especially because if you're watching the news or reading up on this variant, there is still very little information. It's all preliminary scientific data based from other countries, and unfortunately, right now, the information we're receiving is very conflicting. Going from Omicron being more of a seasonal flu to Omicron being more serious and severe, and it's very difficult at this particular time to make heads or tails of that. So the conflicting information is because it's still early and we still have very little data coming out of other countries. What we do know, though, is that Omicron is very transmissible. More so than any of the other variants that we've had up till now. And what we are predicting is that Omicron will be the most predominant variant by Christmas or just after Christmas. So that means that whereas we've been staying steady at I guess a transmission rate that's quite low over the last several months, we're now seeing a lot of transmission of Omicron. In the Montérégie area, we have 5 cases that have been identified. So the Quebec government is starting to sequence or has been sequencing positive cases to try to identify the type of variant that it is. So there are 5 in the Montérégie area. We don't have any in Kahnawà up till now. So our recent cases are not related to the Omicron variant, although we have seen a lot of transmission in the last couple of weeks. Preliminary data is showing as well that Omicron is less severe. So what has been released by Quebec information is that people who are getting Omicron are some are being hospitalized, but rarely ending up in the ICU. There is less death, so a less severe variant. But of course, this is still new preliminary information, but we're sharing it just the same. So the fact, though, that Omicron spreads so quickly means that we still have to take care and consideration in our actions, even if it's less severe. And the reason for that is really the long-term or the wider global impact, especially to our healthcare system. Again, all the things we talked about since the beginning of the pandemic, wanting to protect the most vulnerable and also wanting to protect our hospital system. What we've seen in the data recently is that approximately 50,000 procedures have been delayed during COVID. 50,000 procedures which have led to death, not related to COVID, but related to many other areas of health and well-being, so mental health as well. And having an excessive amount of cases hospitalized for COVID inevitably has an impact on our ability to respond to other health needs within our healthcare system. And so Omicron, it's normal that there's a percentage of cases that will end up hospitalized. So the more cases you have, well, that percentage increases the amount of possibility of being hospitalized, which then has an impact on all of our other services. So again, it's in our best interest globally to keep the number of cases to a minimum as much as possible. Although we can expect an increase in cases, and that's okay as well. So there has to be a balance between those increase in cases and the percentage that end up hospitalized. And so we'll continue to follow that and keep you updated. Again, what is really important and the biggest message that I want to provide today is that we are empowered and we have the knowledge and education in order to counteract the impacts of any variant, no matter which variant it is. And so I'll just remind you of all the areas that you have control over with respect to this pandemic. The first is about hand washing. Secondly, about distance. Third, ventilation. So opening your windows, airing out the rooms in your homes on a regular basis, a few times a day, especially if you have people coming over. We have masking. We need to be vigilant about our masking measures. Even if we're vaccinated, all of us need to be vigilant about our masking measures. We stay home when we're sick. This is still really important. We shouldn't be going out to gatherings, to restaurants, to sporting events, to school, to work. No matter the situation, when we're sick, we should be staying home. We have quick access to testing facilities. When we're sick, when we have COVID-related symptoms, we should be tested. So right now, if we look at the data across Quebec, it's reported that only about 40% of the population is actually getting tested if they're a contact of a positive case or if they have COVID-related symptoms. We need to increase this so that we get tested when we're sick so that we can rule out COVID. We also have rapid tests. So there are rapid tests that are currently in the schools, but we're really happy to advise you that we will this week or next be receiving a box of 5 rapid tests for every single individual in Kahnawake who's over 1 year old. So we'll be giving you distribution information in the coming days or next week. However, we will have rapid tests available for everybody in the community, of course, along with instructions on their use. So really, really important. These are all elements that we have in our armor. We also have vaccinations. So again, Lloyd spoke about it, but I'll just mention it again, that boosters are available. Vaccinations are another area that we put into our armor, and elements that allow us to have control over our day-to-day and over ourselves, the safety of ourselves, our families, and our community. So with all of those elements that I just mentioned comes a huge personal responsibility. We are all responsible for making decisions about our own safety, about the safety of our families. Do we live with somebody who's vulnerable? Do we live with somebody who has a higher risk than each of us as individuals? How do we take care of the collective? So we all have that responsibility, and the community has done a really good job of taking that responsibility seriously. And we will continue to do that as we move through this pandemic and the different waves and changes that happen over time. We haven't gotten rid of it, but we've done a really good job of keeping on top of things and keeping each other safe. So that's what we need to continue to do. Part of that strategy is, again, a harm reduction strategy. How do we stay as safe as possible with all of these elements and all of these safeguards that we have in place? Part of that, as I mentioned, is getting tested. So I just wanted to do a quick shout out to the testing site today. The testing site actually hit 10,000 tests this week. We've done 10,000 tests on community members since the beginning of the pandemic. So they've worked really, really hard to be able to provide that service to the community, and it's made a difference in our ability to keep the community safe. What we ask is that you continue to get tested, whether it be at the KMHC site or another site. And I also want to talk a little bit about rapid tests as a part of that strategy for testing. So PCR tests are the most accurate, reliable tests that you can do for COVID. A rapid test is another safety measure that you can add, that you add to your armor, as I mentioned. But rapid tests are not as reliable. So we will provide you with some suggestions on when and how to use them when we distribute them. But we also want to make sure that you're aware that their reliability, the results are not as reliable as a PCR, and therefore if you get a negative result, it doesn't mean for sure that you're negative. And if you get a positive result, it doesn't mean for sure that you're positive. So, so it's really important that a positive result be followed up with a PCR. And a negative result, if your symptoms continue, then we urge you to get a PCR test. I'm talking about rapid tests because I know that a lot of community members have started doing private rapid tests rather than doing PCRs when they're sick. And I know that some people still feel that COVID is, feel shamed about COVID. And I really want to mention again that it is not shameful to have COVID. Perhaps we might all end up with COVID at some particular time. Remember, our goal is to minimize death and hospitalization, and we will not necessarily eradicate COVID. So it's okay to get COVID. What we're seeing happening is that people are doing rapid tests, perhaps getting a positive result, but not sharing that information with public health. So again, one of the elements in our armor is the ability to isolate people, to contact trace, so make sure that our contacts know when they've been in contact with a positive case so that they can take care of themselves, be more cautious, and be more protective of their environment. And we also isolate. So if the public health team is not aware that you're a positive case, we can't assist you with this whole process. So we do ask that if you do have a rapid test done and you have a positive result, that you have it validated by a PCR-1, and if not validated by a PCR, that you at least advise public health that you are positive, secondly. And if you absolutely are not going to advise public health, then we do urge you to advise all of your contacts, and you have to think of all the settings that you've been in. Advise all of your contacts that you are positive so that they can take measures to protect themselves and their families as well. And again, this is about protecting the community as a whole. So the more we have knowledge, the more we use it in a positive way, the more that we protect each other. So what we might see with the increase in cases that we expect over the coming weeks is an inability for public health, or the KMHC public health team, to do full contact tracing the way we've been doing up until now. So the regional teams in Montérégie and all of Quebec, in fact, they no longer call contacts of positive cases, but KMHC has continued to do that as much as possible and as quickly as possible because we feel it's an important strategy in containing the transmission of the virus, but we are predicting that we will no longer be able to do that in a very short period of time, perhaps over the holidays, even if not before. And so when that change happens, well, this is a first sensitization to all of you that that we really urge you to take on that personal responsibility to advise your contacts that you are positive. And once public health can no longer participate in that process or no longer keep up with that process, then we will be giving you a more formal, I guess, list of responsibilities as somebody who is a positive COVID case, so that you participate in protecting the community as a whole. So we'll be giving more information in writing about that shortly. But again, it's all part of this same strategy of moving towards a state of normalcy. Even when we get to a state of normalcy, COVID may still exist, and we all will have a responsibility within that state of normalcy to keep the community safe. And this is part of the process, is giving back that responsibility to individuals. So we, again, will have more information for you about that shortly. So I think that Lloyd wanted to come back on to talk about the holidays, so I'm going to turn this back over to him. And if I don't see you before then, I would like to wish you all very safe, beautiful, loving moments with family and friends. Thank you.
Thank you very much, Lisa. I just want to touch back on really something quick before we close up here. As Lisa mentioned, though, across the province, they're expecting the Omicron variant to become the dominant strain in the next few weeks. But just keep in mind that as we speak today and over the next couple of weeks, the Delta variant is still the one that's driving the pandemic, in and around Kahnawà. So obviously, we know the Delta variant could be very serious, to everybody. So we all have to do our part again to keep ourselves safe. And even with the latest information on the new variant, as we've seen throughout the pandemic, some people will have very mild symptoms, and some people, it can be very, very serious. So we got to keep that in mind, as we navigate through this holiday season. because we know, like I said, people want to gather and spend time with their loved ones. We are very happy to be able to get the formal news yesterday that with the rapid tests that were secured. As Lisa mentioned, public safety and public health have been lobbying for these rapid tests to deploy a new strategy, across Kahnawà and for all First Nations for that matter. And so we will have a substantial amount of tests available in the coming weeks. We don't have control over the supply chain at this point in time, but we will keep the community updated when we do get them, and we will have a method to distribute them to the community, further information and videos and such, so that people will be clear how to use them and some recommendations on when to use them. And just like one example, before everybody gathering over at the grandparents' house, you may want to have everybody take a test, just to have that additional level of protection to protect, again, everybody, but also the most vulnerable. So this holiday season, it's much different than we've seen last year. There is much more flexibility, there's much more options for people to do. But again, we just want to keep underscoring the fact of doing it as safe as possible. And the basics of public safety and public health and the measures are what going to carry us through into the new year. So we will, this will be, I should say, our last show officially scheduled for the remainder of the year. If there is a need, as we said many times, to have updates to the community that are urgent, we will have a show. But we will be releasing various press releases and information throughout the community on all relevant information. So keep your eyes peeled to local media, our 911 Facebook page and such. So there's going to be information on there on a regular basis. So with that, I know it's been a lot of information. But we want to be here to the community to let you know that we have a whole team. It's not just Lisa and I. We have a lot of people working behind the scenes with us, and a lot of experts that are working along with us to help guide the community forward. We're watching everything very carefully, and we're putting the pieces of the toolbox so that we could keep our community safe as possible as we weather through this next phase of the pandemic. So with that, I still want to wish everybody a very Merry Christmas and make the best of your holidays. Be safe and talk to you soon. Onigawahi.